Good morning and welcome to AI in Healthcare. I'm Dr. Keith Dreyer, Chief Data Science Officer and Radiologist at Massachusetts General Hospital.
And I'm Dr. Sheila Agarwal, Chief Medical Information Officer at Microsoft and a radiologist as well. Today, we'll be referencing a publication and want to acknowledge the tremendous work of the primary author, Dr. Ibrahim, as well as our other co-authors, Drs. Kalra, Bizzo, Wald, and Allen, and Ms. El-Kholi.
So I'm sure many of you saw that New York Times article about the FDA's device division. Everyone's talking about it. New director, new concerns about AI regulation, ethics industry, influence, all that. But today we're going deeper. We're actually taking a closer look at a study that the New York Times article mentioned.
That's right.
And get this, we actually co-authored the paper.
We did.
It's called FDA-Regulated AI Algorithms, Trends, Strengths, and Gaps of Validation.
Published in Academic Radiology.
So first things first, AI and radiology. It's everywhere.
It really is.
I mean, the paper mentions a jump from something like 600 publications in 2010 to over 12,400 in 2019.
Yeah, it really speaks to the potential that AI has in radiology. I mean, you can use it for triaging cases, spotting tiny details that radiologists might miss, even quantifying findings.
It's exciting stuff for sure. But the New York Times article also brought up some concerns about how the FDA is approving these algorithms.
Yeah.
They mentioned transparency issues, which always makes me a little nervous.
Yeah, that's understandable.
So what's the deal there?
Well, as part of the ACR's Data Science Institute, we decided to do our own audit of these FDA-approved AI algorithms.
Okay.
And right away, we hit a wall. Just try finding detailed public information about how these algorithms were actually validated.
FDA is approving these powerful tools, but we have almost no clue how they were tested.
Pretty much.
That doesn't sound great.
Yeah, that's a big problem. And it's actually what we call the validation gap in our paper.
Validation gap.
Yeah, without that validation information, it's incredibly difficult to know if an algorithm will actually work in the real world with real patients.
Right, because what works in a lab setting with perfect data might not work in a busy hospital with all sorts of different patients. Okay, so less transparency. Big concern.
Yeah.
Got it. What did your research uncover about the validation data or the lack thereof for these algorithms?
Well, one of the most surprising things we found was the size of the data sets used to train these AIs.
Okay.
Most of them were validated on less than 500 patients.
500 patients? That's a tiny sample size.
It is, and it's a big problem, especially for tasks like image processing and quantification, where patient demographics can really impact the results.
Can you give me an example?
Sure. Imagine an algorithm that's trained to measure lung function using CT scans, but it's only trained on young, healthy individuals. How accurate do you think it'll be for someone older or with a pre-existing lung condition?
Probably not very accurate. Right. So small data sets, potential for bias. Anything else stand out in your research?
We also found a lack of information about patient demographics.
Things like age and gender and race.
Exactly. All of that. And that makes it hard to know if an algorithm is truly generalizable to the diverse population we see in clinical practice.
So let me guess, a breast cancer detection AI that's primarily trained on images from white women might not be as accurate for women of color.
That's a great example. We need diverse and representative data to make sure these algorithms are fair and effective for everyone.
Were there any algorithms that stood out to you as having particularly good validation data?
Actually, yes. Two in particular were great. Profound AI Software v2.1, which helps detect certain issues in breast tomography, and AI Rad Companion, Pulmonary, which focuses on lung analysis. Both of them were validated on datasets of over 4,500 patients.
Wow, that's way more than the others. Right. So it is possible to do large-scale validation studies.
It absolutely is, and those two algorithms set a great example for future AI development. I think as we move forward, we really need to push for robust validation on large, diverse datasets.
So you mentioned the validation gap earlier. Can you explain that a bit more? Why is it such a big deal that we're missing this validation information?
Sure, think of it this way. You're a doctor. You're considering using a new AI tool to help you diagnose patients. Wouldn't you want to know exactly how it was tested and on whom?
Of course I would. I'd want to be confident that it's accurate and reliable before I start using it on my patients.
Exactly. And without that validation data, it's like driving a car without knowing if the brakes work. You might be fine for a while, but eventually,
Yikes. Okay, that's a scary analogy. I'm starting to see why this is such a critical issue. But what can we actually do about it?
Well, first, we need to raise awareness. People need to know that this is a problem, okay? Second, we need to push for greater transparency from the FDA and the companies that are developing. And third, we need to advocate for more rigorous validation standards. We need to make sure that these algorithms are being tested on large, diverse data sets that are truly representative of the patients we see in the real world.
All right, so there's work to be done. But in the meantime, how can listeners protect themselves? I mean, most people aren't reading academic radiology journals.
That's true, but there are things you can do. First, don't be afraid to ask your doctor questions. If they're recommending a test or treatment that involves AI, find out how the algorithm was validated.
What kind of questions should we be asking?
Ask about the size and diversity of the data set, the algorithm's performance on different patient populations, and any potential limitations.
Okay,
And if you're not satisfied with the answers, don't hesitate to get a second opinion.
that's great advice. It's our health after all. We have a right to be informed and involved in our care decisions.
Absolutely. And remember, AI is a powerful tool, but it's just that, a tool. It's not a replacement for human judgment and expertise. So stay informed, stay engaged, and keep asking those tough questions.
Okay, let's pause here for a moment and we've covered a lot of ground already,
We have,
but this conversation is far from over.
definitely.
We'll be right back after a quick break to discuss what this all means for the future of AI and radiology. Stay tuned.
Sounds good.
All right, we're back. Before the break, we were talking about that validation gap in AI algorithms and how important it is to ask questions about how these tools are tested.
Yeah, and remember that New York Times article you mentioned? It also pointed out that the FDA has very limited resources to really oversee all of this.
Right, so even if they had all the validation data, it sounds like they might not have enough staff to really dig into it,
That's a valid concern.
which I guess makes real-world surveillance even more crucial.
Absolutely.
So what does that look like?
Well, real world surveillance basically means monitoring how these algorithms perform once they're out in the wild, being used on diverse patients in all sorts of different clinical settings. We need to make sure they're actually working as intended and that any unexpected problems or biases are caught quickly.
So basically constantly checking up on them, making sure they're behaving themselves out there in the real world.
Exactly. And it's not just about safety and effectiveness either.
What else is it about?
It's also about making sure that these algorithms are being used ethically and responsibly.
Right, that makes sense. So looking ahead, what do you think is the future of AI in radiology? Are we headed towards a world where robots are reading all our scans?
I don't think it's about replacing radiologists entirely. It's more about augmenting our capabilities. AI can help us be more efficient, more accurate, and ultimately better at what we do.
So think of AI as a really, really smart assistant, not a replacement.
That's a great way to put it. It can help us with those repetitive tasks, flag potential problems we might miss, and even quantify findings more precisely. And that frees us up to focus on the more complex cases, the ones that require that human expertise and judgment.
That makes me feel better. I was picturing myself out of a job in a few years.
I don't think you have to worry about that just yet.
But seriously, it sounds like this partnership between humans and AI could lead to some major improvements in patient care.
Absolutely. Imagine being able to diagnose diseases earlier, personalize treatment plans more effectively, and even predict patient outcomes with greater accuracy. That's the potential we're talking about.
That's incredible, but let's be real. There are still some challenges to overcome.
Yeah, for sure.
We've talked about the validation gap, the limited resources at the FDA. What else should we be thinking about as AI becomes more and more integrated into healthcare?
I think one of the biggest things is access and equity.
Oh, yeah,
We need to make sure that these powerful AI tools are available to everyone,
right?
not just those who can afford them or who live in certain areas.
Exactly. We don't want to create a system where only the privileged few have access to the best AI-powered
I
healthcare.
completely agree. And it's not just about access to the technology itself either.
Okay,
It's also about ensuring that the algorithms themselves are fair and unbiased. so we don't end up perpetuating those existing healthcare disparities.
So it's a two-pronged approach.
Yeah,
Making sure the technology is accessible to all and that the algorithms themselves are equitable.
exactly. And that's going to require a concerted effort from everyone: researchers, clinicians, policymakers, the public.
Everyone's got to be on board with this.
We all need to work together to make sure that AI is used to benefit everyone, not just a select few.
You know, one thing I've been wondering about is the impact of all this on the doctor-patient relationship.
Mhm.
Will AI change how we interact with our doctors?
That's a great question. And I actually think there's potential for AI to strengthen that doctor patient relationship. By taking over some of those more routine tasks, AI can free up doctors to spend more time with their patients, listening to their concerns and explaining things in a way that they can understand.
So less time staring at a computer screen, more time making eye contact and having those meaningful conversations.
Exactly. I think that would be a win for everyone.
Definitely. And imagine this AI could analyze your medical history, your lifestyle factors, even your genetic predisposition to certain diseases, and then give your doctor all these personalized insights to help them make better decisions about your care.
That's the dream.
That's amazing. Yeah, it's like having a superpowered medical detective working alongside your doctor,
It kind of is, but it's important to remember that AI is a tool.
right?
And like any tool, it can be used for good or for bad. It's up to us as a society to decide how we want to use it.
So it's not just about the science, it's about the ethics too.
Absolutely. We need to have these thoughtful discussions about the potential implications of AI in healthcare and develop guidelines to ensure that it's used responsibly.
I feel like we've only just scratched the surface of this topic.
It's so complex.
Artificial intelligence and radiology. It's a rapidly evolving field.
It really is.
But it's also incredibly exciting. I mean, we're on the cusp of a major transformation in healthcare, and AI is going to be right at the center of it all.
No doubt.
Well, I, for one, am really excited to see what the future holds. We'll be right back after a quick message to wrap up our deep dive into AI and radiology and leave you with some final thoughts.
Sounds good.
Stay tuned. Okay, we're back, and we have been talking about all this exciting stuff with AI and radiology, the potential benefits and the need for all that careful validation and oversight. But let's bring this back to you, the listener. What does all this mean for someone who's not a doctor or a data scientist?
Well, the truth is, this stuff impacts everyone. Even if you're not in the medical field, AI is already being used in healthcare in ways you probably don't even realize.
There's not just some far off future thing. This is happening now.
Exactly. It's happening now, and its influence is only going to grow. So it's really important for us to be informed as patients. We're consumers of healthcare, right? And just like you wouldn't buy a car without doing your research, you shouldn't just blindly accept any new medical technology.
Especially when it comes to something as powerful as AI. Okay, that makes sense. But let's be real for a second. Most people aren't reading academic journals or FDA approval documents.
True.
How can the average person even begin to stay informed about all this?
Yeah, that's a fair point. It can be really tough to navigate all that information. But there are resources out there like the ACR DSI website. They have a whole list of FDA cleared AI algorithms, and they're actually working to make that information more accessible to the public.
So we can start by checking out their website. What else can we do?
Don't be afraid to ask questions. If your doctor is recommending a test or treatment that involves AI, just ask them about it. How is the algorithm validated? What are the potential benefits and risks?
That's a good point, but I think a lot of people are kind of hesitant to question their doctors.
I understand that, but it's your health that's on the line.
That's true.
You have a right to be informed and to really participate in decisions about your care, and a good doctor is going to welcome those questions and take the time to explain things clearly. Ask for clarification. Don't be shy.
And if we don't understand something or we want more information,
Keep asking until you really feel comfortable with the answers.
okay, so ask questions, don't be shy. What else?
Well, I think it's also really important to remember that AI is a tool, not a magic solution. It definitely has its limitations.
Yeah, I can't replace human judgment and expertise.
Exactly.
Yeah,
It's here to help us be better, but it's not perfect.
so we have to find that balance. Embrace the amazing potential of AI, but also be mindful of its limitations.
I think that's a great way to put it.
Well, this has been an incredibly fascinating conversation.
It really has.
Thanks so much for joining us today to talk about AI and radiology.
It's been my pleasure.
And to our listeners out there, remember, stay curious, stay informed, and keep asking those tough questions. We'll catch you next time for another deep dive into a topic that's sure to spark your curiosity. Until then, take care.